I've recently returned from Taiz, Yemen's third largest city, and the situation there is catastrophic. I mean, we must consider that the city itself is ringed by active front lines, and MSF, we are providing care to the population on both sides. Being inside the enclave itself within the city, the situation is drastic and difficult, and there's very little presence for humanitarian actors and space for them to be able to work. I mean, for ourselves, we're providing support to 3 hospitals, providing care for maternal services, paediatric services, war-wounded patients, and in spite of all the challenges, we stay there. But the first thing that hits you is just how cut off the city feels. You've got a huge population, many young people, all of which are unable to access medical care as they would in any other scenario or any other circumstance. The public healthcare system in Yemen is de facto collapsed, and the consequences of that are relatively logical and comparable to what we see in other conflict zones around the world. We have an increase in vaccine preventable diseases such as cholera, such as measles, such as diphtheria. We're seeing a significant gap in maternal health care right across the country, and a need for a huge scale up for war wounded and trauma care. There's no family in Yemen that is not being touched by this conflict, and the situation is getting worse and it's not getting better. Since we've significantly increased our operations in 2015, we've been bombed from the sky, we've had our doctors shot at, we've had bombs planted in our hospital. Yemen is very difficult, but this pales in comparison to the challenges faced by Yemenis every single day trying to live a normal life in their own country. We see the need for an increase in care for war-wounded patients and significant gaps in maternal health care. For 3 years, we've been calling for an increase in medical humanitarian aid in the country. To date, what we see is not enough to care for the needs of Yemen's 27 million people.